Hi, Maxine, how are you?
Hey, Natasha, good, thanks. And you?
I'm all good. So just waiting for Cindy and uh Chilekwa to come on.
Perfect.
Are you gonna keep your camera on or off for this?
I don't know, put it on. Let me just test it quick.
Sure. Excellent. I can see you.
Oh, great.
Okay, I'm just gonna check with Chilekwa if she's on her way. I see Cindy has joined. Hi, Cindy, welcome.
Hi there. Sorry, I was struggling to get my unmute off. Hi,
Oh, no
thank you.
problem. Okay, I can hear you loud and clear. Do you want to turn your camera on so we can check if that's working fine?
Sure. How much camera do you use? Is that working all right?
That's perfect, yes. You can keep it off until you actually have to present if you'd be more comfortable with
Okay.
that.
And then do we just turn it on for the presentation? And what about the discussion? Is that all via typing?
Yeah, so the participants will discuss in the chat, and then if there are questions that come up or any specific points you're interested in replying to, then you're welcome to do it by speaking with your camera on if you want.
Okay, that's cool. I'm
Yeah.
I'm not the best typist.
That's all right. You can speak. Yeah, and Maxine, if there's any issues or if it's too much, Maxine can help point out some questions, and I can also help out as well.
Okay, lovely. How many people have registered? I know it's a lot of other things happening.
Yeah, about 60 something people have registered, so it's a
Okay.
good turnout.
That's cool.
Yep, I'm gonna mute myself and see what's happening
Yes,
with
and I'm going to
Chilekwa.
turn my camera and mute myself as well. Okay, cool.
No problem.
Thanks. Thanks.
Good afternoon, everyone, and welcome to those who have joined already. We will begin our discussion at 2 o'clock, but in the meantime, please feel free to introduce yourselves in the chat. We would love to know your name, the organization that you work for, and the country that you are from. And please also feel free to answer the poll that is on the screen at the moment. You can do this by using Mentimeter. So you go to menti.com and use the code at the top of the screen, or you can use the link that has been posted in the chat. Thank you so much. We will begin at 2 o'clock, but yes, we encourage you to continue to introduce yourselves in the chat.
Hi, Chilekwa, welcome. Can you see and hear us?
Good afternoon. Yes, please. I can hear you.
Excellent.
Thank you.
All right, good afternoon, everybody, and thank you so much for joining this discussion. We welcome you from the Division of Environmental Health from University of Cape Town, and welcome to our Pesticide Discussion Forum. We are so glad to have you here. I would like to start by just introducing myself. I am Maxine Jonker, and I work as a project manager in our division, and I'll be your facilitator for this discussion today. I'd also like to introduce you to Natasha Lalou. She is the coordinator for this network, and she is working in the background with all of our technical and administrative things for today's discussion. And so if you have any issues, please feel free to let her know. As mentioned earlier, to those who joined, but if anyone has just joined us, welcome, and please introduce yourself in the chat. We would love to know which country you're from, the organization that you represent, and we would love to know who you are. So please feel free to introduce yourselves in the chat as you join. There's also a poll on the screen at the moment. You can access this poll by going to menti.com and entering in the code that is at the top of the screen, or you can use the link that has been posted in the chat. Please let us know which industry you represent. We would also love to know who is joining us today. So before we start, I would like to let you know about the purpose of these discussions. So the purpose of the UCT's Pesticide Discussion Forum is to bring representatives from different regions, sectors, and stakeholder groups together to foster a mutually supporting consortium of stakeholders to discuss various issues related to pesticides. Particularly, we aim to build capacity of regulators, researchers, and NGOs in low and middle income countries and to discuss emerging issues. We hope to achieve this by learning from each other, sharing information and data, identifying gaps, and problem solve collectively to reduce and prevent pesticide poisonings and environmental contamination, with a view to a toxic-free future for the next generation. I'd love to explain how our discussion is going to work today. So some of you may know this is not a webinar, but rather a chat discussion. We ask that you keep your microphones muted and your cameras off to help us with bandwidth issues for anyone that may join today. This is a non-partisan discussion. We respect all viewpoints and we value all input. When you are answering a question or posting something in the chat, we ask that you please add your country and your organization into your response, and we encourage you to engage with other people's responses in the chat as well. So how this discussion will work is we will start off with a brief presentation from our presenters. After that, we will post a question in the chat. This can then be answered by everyone who has joined us today in the chat, and we will discuss this question for a few minutes. We will post a 5-minute warning, which will just let you know that we are about to move on to our next set of presentations. And at that point, you can kind of wrap up your final thoughts before we move on in the discussion. Throughout the process, we will also be posting polls using Mentimeter again, so please interact with our polls and send us your responses. We always love to see what you think. And once again, we'll give you the way that you can vote on the polls throughout the discussion. So I think we can move on to beginning today's discussion. Natasha, if you'll just go to the next slide for me, please. So today's discussion is entitled The Roles and Challenges of Poison Information Centers in Africa in Addressing Pesticide Poisoning. And we have two presenters with us today that are very skilled in this area, Cindy Stephen and Chilekwa Mibenge from Zambia. And Cindy is from the Poison Information Center at Red Cross Children's Hospital here in Cape Town. So I think we can move on to the next slide. And what I'm going to ask is that our two presenters just briefly come on and introduce themselves. Cindy, if you wouldn't mind just unmuting and turning on your mic and then just giving us a brief introduction.
Good afternoon. Thank you so much, Maxine and Natasha. It's lovely to be part of the discussion this afternoon. As Maxine has said, I'm a medical doctor and the director of the Poison Center at the Red Cross Children's Hospital in Cape Town. And we, along with our colleagues at the Tygerberg Hospital Poison Center, provide a national poison helpline service to the people of South Africa. Thank you. And hello to Chilekwa as well.
Great. Thank you so much, Cindy. Chilekwa, I'll hand over to you for an introduction.
Thank you. Good afternoon, everybody. Good afternoon, Maxine. Thank you, Natasha, for this. My name is Chilekwa Mibenge from Ministry of Health, Zambia. I'm a Chief Environmental Health Officer. Thank you.
Great. Thank you so much to our two presenters. And we are very excited for this discussion today and to hear your expertise on this topic. So without further ado, I will hand over to Cindy, who's going to begin our first set of presentations for us. Thanks, Cindy.
Okay, thanks so much. And just to confirm, Natasha, would you move the slides along for me? Is that correct?
Yes, that is correct. You can just say next slide.
Okay, cool. Okay, well, let's have the first slide, please. So I always find it useful before we start a conversation that looks at poison information centers and their role in pesticide poisoning, for us to have a kind of more global look at how poisoning fits in to the world array of what causes mortality. And so this chart is from the Global Burden of Disease from 2017. And normally it's one of those animated charts. So we look at it and then I click and in comes poisoning. Just so that we can just see that really poisoning in terms of global mortality is a very, very small, although significant cause. So the blue blocks are all the non-communicable diseases like stroke and ischemic heart disease and cancer. The pink blocks are the communicable diseases like TB and malaria, etc. And then the green blocks are accidents and injuries, and poisoning sits there. And as you can see, just a 0.13% of all deaths. But, and next slide, please, Natasha. Nevertheless, even though it's such a small contributor to world mortality, WHO still believes, as do we, that poisoning really presents a significant global public health problem. And so you can see, and this data is even a bit dated, but when it was produced, you can see that nearly 200,000 people die annually around the world from unintentional poisoning. And the thing to note really is that the lower middle income countries are the area where most of these poisonings happen. So 84% of poisonings happen in low and middle income countries. And then, of course, we come to suicide, nearly 1 million or more deaths every year from suicide. And this is where we see pesticides coming in. Over a third of these deaths from suicide are due to pesticide ingestion. And then, of course, snake bite, which is not of importance to us today, but is another thing that is covered by poison information centers. Thanks, Natasha. Next slide, please. It's important for us to look globally at the international health regulations. So these were revised and adopted in 2007 by the World Health Assembly. And the purpose really was to prevent, detect, respond to, and manage public health risks of potential international concern. And this includes, in the regulations, chemical events or exposures. So the onus on member states, and I'm sure many of the countries represented here in our discussion today are WHO member states, South Africa certainly is. So member states must establish and maintain structures and systems for disease surveillance and outbreak response to hazards. And of course, this includes chemicals. So what does this actually mean in detail? Can we go to the next slide, please? So to kind of see what action this needs to include, the WHO in 2018 developed a benchmarking tool and a state annual reporting framework. And it includes actions that must be taken for certain indicators for a particular member state or country to reach a particular level. And you can see already that for this particular indicator in the red marked blocks at level 2 and 3, that we see poison centers begin to be mentioned. So at a level 2, and remember we're aiming to be at level 5 to fully be applying the international health regulations. So at level 2, surveillance capacity for chemical exposures must be available in that country, at least on an ad hoc basis. For example, a poison information service that may just operate during office hours or only serves part of the country, and laboratory capacity to identify key chemicals of concern. So that'll be level 2. At level 3, we want a poison information service performing a national service that's available 24/7. So we need to realize that poison information centers are intimately embedded in the international health regulations. And can we move to the next slide just for a slight bit more detail? You can see that these are the recommended actions. So to get to those particular levels, 1, 2, 3, 4, or 5, countries are encouraged to perform the following actions. And this just picks up what I've mentioned. To get to level 2, a country needs to develop capacities for diagnosis and treatment of poisonings. And for level 3, countries' governments should be providing adequate resources to a national poison information service to enable it to operate 24/7. So this is fantastic support from the international health regulations. And excitingly, Natasha, can you go to the next slide, please? So Prof. Andrea Rother, who I'm sure you all know, sent this through to me this week. She's currently attending the ICCM5 in Bonn. And on Tuesday this week, she was very excited to share that Target 6 will include this text, that by, I'm not sure what the year will be, all countries must have access to a poison center equipped with essential capabilities to prevent and respond to poisonings, as well as access to training on chemical risk prevention and clinical toxicology. So I hope that this has shown that poison centers, at least from a global wish list point of view, are fully supported. So let's go to the next slide. What then are the roles of poison centers? Looking at it at a bit more of a granular level. And essentially, poison centers contribute in these 3 areas: to clinical care, providing an information service, assisting nurses and doctors to diagnose and manage poisoning, patients who have been poisoned, either clinically treating them and or providing laboratory service. And then also poison centers should be creating databases of products and substances so that these can be identified and patients treated appropriately. Then there's also an important public health contribution that poison centers make, particularly data collection, as they are really one of the most important sources of poison data for government. Of course, we can be involved in toxicovigilance, antidote surveillance, and then working in the area of poisons prevention. And all of this, of course, applies particularly to pesticides. And then lastly, poison centers have a role in the safe and sound management of chemicals. Thanks, Natasha. Can we move on? So put kind of more simply, with not so much information, essentially a poison center is a specialized unit that advises on and assists with the prevention, diagnosis, and management of poisoning. So at the very minimum, a poison center is an information service. And just broadly speaking, and maybe this would be relevant as you fill in or respond to the questions in our chat this afternoon, a poison center should provide clinical advice. Office hours, it should really be available at least during office hours in the week, ideally 24/7. A poison center needs staff. You need at least 3 or 4 specialists in poison information and a manager. And then, of course, a poison center needs infrastructure. It needs an office. It needs a phone line that's reliable, computers, IT equipment, and access to the relevant databases. And of course, all of that requires training and capacity building. Thank you. Let's move on to the next slide. So WHO has very helpfully recently released this publication, Guidelines for Establishing a Poison Center. So if you want to find out more detail, it's a really worthwhile resource. But basically, we need to determine, if you're wanting to set up a poison center, an appropriate location. You must have good communications. We need equipment and staff. And the picture here is, in fact, from our poison center at Red Cross, and one of my colleagues there busy answering the poison information helpline and responding to a query from a caller. Next slide, please. So when we think of poison centers, they can come in a number of different models, and particularly in low middle income countries, of which South Africa is one, a poison information center service on its own is often the most viable option. In the global north, many, well, not many, but some of the poison centers there are associated with a clinical toxicology unit. In other words, they will be at a hospital where there is a ward where where they have a few beds, maybe up to 6 beds, where patients with poisoning will be admitted and looked after by the poison center staff. Another model is to have a poison center associated closely with an analytical laboratory, and I know this is the case in Algeria. And yet another option, and I think some of these options also happen in Africa, you'll have a poison center that is associated with medicines information and with a pharmacology service. And of course, one can have a bit of a mix and a match of these different models as well. But all of them will fulfill the essential service and role of a poison information center. But where do we sit when we look at Africa? And again, this would normally be an animated slide. I'm sorry, I don't know, Natasha, can you make it animated for me? Because it's useful to see the whole world before we see Africa. I don't know if it's possible for you to do that.
Sorry, it didn't come out animated. I did not realize. Sorry about that.
Okay, no, it's fine. Is this a PDF? Because on the PowerPoint, when I looked at it earlier, it was working with animations, but if you shared the PDF, it won't. But anyway, I'm sorry we can't correct that, because the purpose of the map, the world map, is to show you how North America, Europe have a huge number of poison centers. I mean, you can see a little bit of it at the top here in Europe. But whereas when we come to Africa, it's very, very sparse. And I think there are only about 11 or 12 African states that currently have a poison center. And there is in progress a new WH report that will be looking at a survey of what poison centers are available in Africa. And hopefully that will be released and in the public domain, certainly before the end of the year. But it'll be good to hear from everybody on this call about the situation of a poison center in their country. So let's move on to the next slide. So how does this all fit in with pesticides? Because that's clearly the main focus of our conversation today. And you can see that although a poison center has a very wide sphere of influence, it collects statistics on circumstances of exposure to all chemicals and what happens. Nevertheless, pesticides, and you can see them there as one of the circles around the kind of focal point of the poison center, is a very important and perhaps globally increasingly significant focus for poison centers to have. But what can poison centers actually offer when it comes to pesticide poisoning? And I want to finish the presentation with some of the experience, just in one slide, of what the poison centers in South Africa have tried to do in the area of pesticide poisoning. So if I can just go to the last slide, or the second last slide, please, Natasha. So the kind of 3 areas where the poison centers in South Africa have made a contribution is firstly in the area of notifiable medical conditions. So poisoning due to pesticides has been, in fact, legally notifiable to government for many, many years. But we realized only a couple of years ago that, in fact, there was no case definition for health workers to use to know when they should notify a patient or not. And so very few, in fact, extremely few cases of pesticide poisoning were ever notified to the authorities, which is a huge gap in response. And so our Poison Centre worked with some of the government agencies in South Africa to rectify this. And I think it was just last year we finally managed to have approved and published case definitions for pesticide poisoning, which you can see briefly there. And this has meant that we can circulate this more widely, try and raise awareness amongst health workers of the importance of notifying every patient with pesticide poisoning, because there are many, many more out there than what we collect on our poison helpline service. Which takes me to the second area we've contributed, which is in providing data. So if you look at the charts on the right-hand side of this slide, they show the data we collected during the last year, 2022. In South Africa, our poison helpline operates 24/7, and we get about over 1,000 calls a month, 1,100 calls per month from everywhere in the country. And this is the kind of data that we can extract and we share with government on a quarterly basis. And you can see that in South Africa, pesticides account for 13% of all poisoning calls that we receive. And we can break this down even further if you look at the pie chart at the bottom to see exactly which pesticides specifically, which active ingredients are causing the most problem, causing the most symptomatic patients, and are most widely available. So that's the second area, providing data for government, because in our experience, if governments don't have data, they're not going to do anything or change regulations or try and implement them better. And then the last thing we've done as poison centres in South Africa is try to raise awareness. So at the bottom there is a magnet with our Poisons Helpline number on it and a few key points what to do when someone is poisoned or when you come across a family member who has taken a poison or been exposed. And so that's the third part of what we've tried to do as poison centres for pesticide poisoning in South Africa. And I'm looking forward now, thank you, we can just go to the last slide, which is just a thank you slide, but I'm looking forward to hearing people's experience of poisoning and poison centres and pesticides in particular in your countries. Thank you. And those are some resources that might be useful.
Great. Thank you so much, Cindy. That was great. And I hope everyone enjoyed that very informative presentation. So we are heading into our first question now. We'll be discussing this question for about 20 minutes or so. Question 1 reads, in your opinion, do poison information centers play a role in preventing pesticide poisoning? Give examples in your response and include your country. So please feel free, this question has been posted in the chat. Please feel free to answer it and let us know your opinions and your thoughts. If you also have any questions for Cindy or anything else that you would like to ask in the chat, please feel free to go ahead. You can begin discussing, and yeah, we will post some polls in a few minutes' time. Yeah, we can start off. Cindy, I see there is a question for you in the chat. I don't know if you would like to respond to that.
Thank you. I was about to type it, but I think maybe I'll just speak. Is that okay? So Debbie, you're welcome to contact either myself or in fact Maxine, because Maxine and Andrea were kindly the people who actually produced the magnets. So either contact me and I'd be very, very happy to get some of the magnets to you to distribute. We're always looking for ways to get them out there, particularly beyond it. Just looking in the South African context, the provinces that use us most are Gauteng, KZN, and the Western Cape. And we're always keen to get magnets to the other provinces as well, or information out there so that we can get calls even more widely than we currently do. Can I respond to the question from Ruben about which pesticides are most incriminated in poisoning cases? I don't know if we can go back to that slide Natasha, where there was a little bit of data there. Interestingly, for us, in terms of the data we collect, in fact, the biggest proportion of patients with pesticide poisoning, we don't know what it is, which highlights a few things. One is the issue of what we call street pesticides, which are readily available at taxi ranks and spaza shops. And often these are completely unregulated. Many are not even in named packages. And so we really have no idea, because we don't have an extensive toxicology laboratory service, an analytical laboratory service. We cannot test each one. And so very often we're not aware. But that said, our most common poison always is the rat poisons, the rodenticides. The most commonly used are the warfarin containing rodenticides. Of course, that doesn't cause such severe poisoning, but that is very commonly available and used. And there are the next most common are organophosphates. And then, of course, we have paraquat as well in our country, which causes such devastating clinical outcomes. Can I pick up one question just to Tom Murray made a comment about the scarcity of poison centers, and therefore the fact that we probably don't play a major role in preventing poisoning. And there's kind of truth in there's truth in that, absolutely. That I think that it's not so much about the kind of number of poison centers, because as you can see, we provide a telephonic service. So one of the kind of big cost-saving things of poison centers is you don't need to have a lot of poison centers. You don't need to have one in every province or every city. You can have one or two or three that cover a whole country, particularly if one works together. So one doesn't need a big number of poison centers, because then one's just duplicating work. So it's much more cost-effective to have fewer. But we don't then have the staff to make a big impact on poison prevention. So that is the part that is absolutely true. And I think I certainly speak from my experience in our poison center, we really don't have the capacity to do a lot of poison prevention training. We try a bit, but it's very it has very limited impact. And I think it also points to the need for governments to support poison centers, which in our context does not really happen significantly at all. One understands constraints in government. I mean, funding is always a huge issue, and they have much, in inverted commas, bigger problems to deal with. Although I do think pesticide poisoning is coming to the fore as a really significant health problem that needs to be given some attention to, and poison centers would play a significant role in that.
Great, thanks, Cindy. So as we continue, we have posted our first poll on the screen. So I see some of you have already started responding, which is great. If you would like to post a response to this poll, you can go to menti.com and use the code at the top of the screen, or you can use the link that has been posted in the chat. We would love to hear your responses. And just a reminder, when you are posting a response in the chat, make sure that you have selected everyone in the to option, just to make sure that you're sending your message to everyone and not just to certain people. Thanks. Cindy, I think we'll move on to the next poll soon. So I don't know if you'd like to just comment on anything that you're seeing from the poll, and then we can move on to our next one.
Not anything in particular, except of course both Lesotho and Eswatini to be great. I mean, we could manage, I think, to do a regional. Well, I think Eswatini does already call South Africa, and Lesotho would be welcome to as well. Although regional poison centers make a lot of sense, there can be issues around cross-country management of patients, which can be complicated. And then the other one I picked up was whoever it is from the US, just to say that, yeah, I mean, the American Poison Control Center network is amazing, and we would love to strive to emulate them. And one of the links in the resources I posted is looking at the CDC and their pesticide awareness and reporting capabilities, which is wonderful.
Great. Okay, I think we can move on to our next poll. So once again, here's a poll on Mentimeter. And as you know, you can either go to menti.com and use the code at the top of the screen to vote, or you can use the link that has been posted in the chat. If anyone has just joined us, welcome, and we encourage you to introduce yourselves in the chat if you have not done so already. We are discussing question 1 at the moment in the chat, and so please feel free to post your responses to question 1. Cindy, I posted something in the chat earlier, just a couple of months ago and last year as well. We did have a focus on pesticide suicide as a topic for the pesticide network, and we explored that a little bit. And I just wondered if you perhaps know of any like research that's been done to show the impact of poison information centers on either preventing pesticide suicides or helping with reporting. I'm not sure if you are aware of anything around that.
Yeah, thanks, Maxine. I'm not aware of research directly looking at poison information centers making an impact on the prevalence of pesticide-related suicides. I was looking actually today at the latest pesticide suicide prevention output, and again, they are at ICCM. And there certainly is a lot of good research looking at banning of pesticides and the impact on suicide, on reducing suicide. And there are a number of countries and good research that indicates that. I think as poison centers, really our role is to provide data to government to highlight that this is really a significant issue. I think that's probably the most important role that poison centers play in terms of having an impact on pesticide-related suicide. And we can, of course, try and raise awareness, but if pesticides are easily available, readily available, and inexpensive, then they will be used. So as I think it's probably more working towards data to support banning of highly hazardous pesticides where poison centers can really make an impact.
Great, thank you so much for that. It's great to see the responses coming into our poll question. Please continue to post your responses. And if you have any questions for Cindy or advice, or you would like to talk about perhaps the poison information centers or lack thereof in your country, please feel free to also post that in the chat, and Cindy will be able to answer any questions and engage with that. We'll wrap this poll up in a few minutes, so please continue to post your responses.
Can I just make one verbal response to Debbie in the chat? Just can you clarify, you say there are many pesticides that cause suicides that are not listed as pesticides that cause suicides. This is the problem. Won't you explain, perhaps in the chat, or give us an example of what you're perhaps referring to there? So I agree with the Gabon comment that really I think in many ways the issues around, or the challenges and barriers for poisons information centers and services in countries is political will and financial resources. Because, and I see someone else has put lack of political will, because truly, and there are a number of studies that show the economics of having a poison center, that it really saves money in terms of preventing unnecessary visits to hospital emergency departments for things that don't need to be managed. It also saves money in ensuring that patients are most efficiently and well treated for a pesticide poisoning. So if we could only get the political will and the understanding of governments to the value of a poison center, it would really be a good investment to put some money into, as has also been mentioned, providing staffing, particularly, and connectivity. And it doesn't matter if one has a very rural country, as long as there's some telecommunication. So in South Africa, we will get calls from the very rural provinces, and it is one way that we can assist and give support. And often it is pesticide poisonings in those areas, but one does need a telephone network at minimum.
Okay, great. So I think we will wrap up this poll and head on to the next one. So this is the final poll for this question. So once again, go to menti.com and use the code at the top of the screen to submit your responses, or use the link posted in the chat. And again, we are still answering question 1 as well. If you haven't answered question 1 yet, please feel free to add your responses and add any questions or anything in the chat that you would like Cindy to respond to.
So can I make a quick comment? I mean, there are very few responses to this question compared to some of the others. And maybe the US, somebody whoever it is from the US who have got such a well-established poison center network, can have some suggestions about how one can get political will, because it feels to me that that's the issue here, is to get government support. And how does one approach one's government to get this? I mean, someone here has also mentioned about the pesticide industry. And I think that's that can be quite a tricky area, because once we engaging with the pesticide industry who have funds, it does raise the issue of a conflict of interest. So I think that's a very tricky and sensitive area in terms of working with pesticide industry in pesticide poisoning, because very often what we know would work would be a banning of pesticides, which is obviously totally counter to what the pesticide industry would like. So I'm not sure how one marries the two, although they do have the resources and are often very supportive.
Okay, I think we'll be wrapping up soon, so please submit your last responses in the chat and continue to post your final thoughts on the poll if you haven't done so yet. Cindy, I don't know if you'd like to wrap up your question with just some final thoughts or anything that you're seeing on this poll that you'd like to point out or discuss, and then we can move on to our next presentation.
Thanks very much, Maxine. I think a lot has been covered. I saw there was an interesting comment in the chat, but I didn't get a chance to read it or respond, but I can do that as we carry on. I think we all understand that poison centers are critical to public health. They get the support of the international health regulations, World Health Organization, etc. So the missing piece is to get our governments to provide the support. There was recently in Europe a brief, a kind of a policy brief was created and has been circulated, looking particularly at poison centers that can be taken to government. And there was a move within Africa. There is a World Health supported network called the African Network of Poison Control Centers. And one of the tasks of that group, just this year, because we met in June in Zambia actually, was to Africanize that particular poison center brief and use African data so that we can perhaps formally approach government and it can be used in each country to try and get the correct political will. Thank you very much. I think that's all from me, and I'll respond to any further comments in the chat. Thanks, Maxine.
Great, thank you so much, Cindy. So I think we will hand over to Chilekwa. Chilekwa, if you be able to turn on your camera and unmute your mic, and then you can take over from here for your presentation. Thanks.
Thank you. Good afternoon once again. So to take over from Cindy, I will share with you where we are as Zambia in terms of poisoning cases and why we need to have the poison center established in Zambia. Can you go to the next slide? So some of the information in my background I've already highlighted by Cindy, so I won't waste much time on that, but I would just want people to be aware that we have those statistics of close to 200,000 people who die every year from pesticide poisoning. And most of these are occurring in low and middle income countries. And you must also take note that most of these pesticide poisoning cases are as a result of self-harm or suicides, with over 1 million of these occurring every year. And from these, a lot of pesticide and chemicals have been linked to the suicides that we've been seeing globally, as well as in Zambia. And these cases are worsened or exacerbated by the current systems that are in place to manage chemicals in the country, as well as to manage poisoning cases. So this make the situation worse because most of these low and middle income countries, like you saw from the map that was shared as regarding to the establishment of poison centers, we do not have much of those established compared to the developed countries. Next slide. So for Zambia being a developing country, we have continued to experience poisoning, which is now a widely recognized problem in Zambia. Most often, so you see almost every other week or month, someone who commits suicide by taking some pesticides. And this has become a common practice. I think even recently, I think a week or so ago, we had another person take their life using these pesticides. And based on that, we conducted a survey to just understand the extent of these cases within the health facilities for a period of 3 years. And what is contributing to these cases increasing some of the challenges that I've highlighted there, which include inadequate surveillance system being put in place, lack of a database. I think for you to effectively manage poison cases, you need to have a system in place where you have a database for all the poison that are there, so that you are able to understand what to give to the person when they are poisoned, or how to manage the case. So that is also one of the key reasons why we undertook the survey, just to have a database and an understanding of what pesticides are out there which are causing all these public health issues. And then also the issue of lack of a poison center, which has been attributed, does provide a lot of information to the health workers, as well as also to the community, if it is effectively implemented and managed. And also the other challenge that we have is the non-mandatory notification of poisoning cases. So when you look at the list of notifiable cases that are to be reported, these poisoning cases are not among the list. So these also make the situation as is, and provide a challenge for the health facilities to adequately manage the poison cases as they continue to rise. Next slide. So the objective, like I mentioned, was to assess the prevalence of the poison in cases in the country, and also look at other factors that may influence the management of the poisoning. So we wanted to establish what it is that can be done to ensure that these cases are well managed within the health facilities. And to do that, we did collect data from all the 10 provinces. Zambia has 10 regions or provinces, and we collected information from the hospitals regarding poisoning that occurred in those years that have been listed there. Next slide. And to share, in summary, the key findings from our survey was that the prevalence of poisoning in the country is high and is seemingly to have an upward trajectory, meaning that we are having more cases now than was before. Maybe it could be attributed to the ease, for instance, in obtaining some of these pesticides. Our regulation is not that strict in terms of who procures and what is sold off the counter and all that. So most of the communities have easy access to these pesticides, which they end up using to harm themselves. So that has really on the increase, and we've seen from the health data that the cases keep rising. And then the other finding was that the health facilities that were assessed did not have adequate knowledge to sufficiently manage the poisoning cases, in as much as they are seeing all these cases coming up within their facilities. When you interview the health workers who are supposed to manage these cases, there were a lot of gaps that were noted in the way they managed these poisoning cases, and also the information that is provided to them to manage these cases. As you may be aware, most of the pesticides poisoning presentation may be similar to other ailments. So the facility staff may end up treating the poison cases as would have been another ailment which would lead to them having a wrong diagnosis and of course a wrong treatment. And in most cases, you end up losing a patient. And then just to also highlight that among the common source of poisoning that was identified was dichlorophos. This is what is commonly used for suicide, self-harm in Zambia. It's also sold off the counter. The restrictions on its procurement are not that well regulated, so there's easy access to it. And then also that there's low awareness on the issue of usage and safety in the community. And most of the cases occur in the urban areas and occur in the homes and not in a place of work. So most of the cases that we're seeing are coming from the households at community level. And of course, from the poisoning, there's intentional and unintentional. And we're able to identify that attempted suicide or the intentional one was the highest cause of poisoning. Next slide. So this is just to show you the different types of pesticides that we found. And you can see dichlorophos there having the highest representation. Next slide. Okay, so like I mentioned, you'd maybe think that most of these cases should be coming from a workplace or a farming area. But from what we found, we were able to establish that most of the poisoning that were actually occurring at household level, at home, in the home. So that is where the biggest challenge is. Next slide. Okay, so this is just to show you the extent of the distribution of the cases. So you can see the dense color there is Lusaka and Central provinces, with the numbers going up to 1,500 cases. And Lusaka is the provincial capital for the country. So it's mostly urban areas and peri-urban areas. So this is where you're having most of the cases occurring in terms of distribution by density. Next slide. Okay, so from the survey, we did make some policy recommendations, and these are some of those that have been listed there. The first one was to ensure that we advocate for the establishment of the Poison Information Center in the country, using one of the models that Cindy shared, and also to strengthen or ban or change the formulation of some of these pesticides so that they cannot cause the harm that they are currently causing. Enhance enforcement. There are some regulations that are there. So what is needed now is also to strengthen this enforcement to ensure that is total adherence to what has been stipulated in the laws. And also to have some guidelines or SOPs which can be used in the health facilities in the treatment of and management of the poison cases. And above all, train the healthcare personnel who handle these cases in terms of effective management of the cases. And lastly, the policy recommendation on awareness creation. We need to talk more on this. Like I mentioned, each other week, you're able to see a life being lost to pesticides, and mostly dichlorophos, like I had indicated earlier. Next slide. Yeah, so as a country, and like has been mentioned, Zambia is a signatory to the international health regulations, and WHO has recommended that each country needs to have that poison center. And I'm happy to hear the news from the latest meetings that have been shared, that countries need to have poison centers established in the near future as soon as possible, and Zambia is crying out for this. Our need to have this center has been long-standing. I think we've been at this case for more than, I think, 10 years now. We're still trying to get there, but I must mention that we are in process of establishing the poison center, and the model that we picked was to firstly start with the national hospital and then have linkages to the regional hospitals. We'll start with the information center part. There are different models like have been mentioned, so we adopted the less complicated one, something that we can learn lessons from. And then after that, based on how the outcomes will be, we extend to the hospitals. So our model is to start with one at the university teaching hospitals, where we have a toxicological lab. And then from there, we move and link the regional hospitals to this center. And also the other step that we've made in this process was to send some toxicologists for training. I think I'm not sure if they are yet to complete their training, but we did send some to Stellenbosch University to get some training in medical toxicology. So we are making headways, and we've also engaged different cooperating partners to see how they can help us to have this center established. We've received technical assistance from different cooperating partners, and we are hoping we can have this done as soon as possible. It's been long overdue, and we need to have this established. I could see from the chat and the discussion that was going, I think most of the Zambians in here do agree that we do need this center up and running as soon as possible. Next slide, please. Okay, so to end, just wanted to share this from WHO so that we can see that where the arrow is, that's Zambia. So these are WHO countries showing the distribution of poison cases. And you can see that we are way above the regional average in terms of the cases. And based on that and the data that we collected from the health facilities, we have seen that there's great need for the country to have this center established. And there is support that has been shown from government. The Ministry of Health has been working with the Zambia Environmental Management Agency to ensure that this is put in place. And we are looking forward to have this established and to also learn lessons from countries that already have these centers established and functioning well, so that we can also have something for the country which can help us to manage these cases and also contribute to the prevention. I saw US member in the chat mentioned that their center is functioning well. So we would like as a country to draw lessons from all those that have these functioning and well established as a country. Thank you so much. I think this should be my last slide. Yeah, and then the next slide is a thank you. Thank you so much. Over to you, Maxine.
Great. Thank you so much, Chilekwa. That was great. And I hope everyone also enjoyed that. So we are moving on to question 2. What is the role of poison information centers in the reduction of pesticide poisoning cases? This question has been posted in the chat. So please give us your responses. I do see there are a few responses already, and Chilekwa, I did see one question that came up during your presentation. Someone was just asking about do we perhaps know a reason why dichlorophos is the most common poison that is implicated in poisoning cases in Zambia? So I don't know if you have the information to be able to answer that question. And there was also just a question about which gender is mostly affected and what is the status, registration status of dichlorophos in Zambia. So there's some questions that perhaps you can respond to verbally if you would like, Chilekwa, and we will continue to discuss this first question as well. Thanks.
Okay. Thank you, Maxine, and thank you for that question. So dichlorophos is highly used, I think, hugely because of its high effectiveness in terms of control of pests. So it's used in most homes to control household pests. And because of its effectiveness in managing this, and also I think the costs associated with getting a bottle of dichlorophos, and now they even have smaller bottles which can be easily accessed, or someone can easily manage to buy off the counter. So it's one of those that is highly effective to control pests at household level. I think that's why it's most commonly used at household level. And the other question, Maxine?
It was just around
On
if there's
gender?
a specific gender that you can see most cases occur in.
Yeah. For that one, I need to go to our database. We did disaggregate the data by sex, so I should be able to provide that. But over and above, I think when we did the survey, we found that we had most of the women also getting affected, and in the interview or in the questionnaire that we used, the women were being exposed as they handle, for instance, the cleaning up of the equipment or tools that were used by the men who were using it, and also because they do the cleaning in the houses. So you see that they have more access to the pesticides and to dichlorophos itself. So I'm not too sure if they were higher, but we did have that data being disaggregated. And I think there was a question on the status of its registration. I've seen colleagues from the Environmental Agency. I hope they could post in the chat. But what I know is that dichlorophos is registered as a pesticide to control household pests as well as in agriculture. And we are working towards its restrictions based on the survey and the data that we have, and its implication in all the poisoning cases that have occurred in the country. So that is something that we are addressing. Thank you, Maxine.
Thanks, Chilekwa. As you can see, we have our first poll for this question posted up. So once again, please go to menti.com and use the code at the top of the screen to post your responses, or use the link that has been posted in the chat as well for in order to respond to this poll. You can continue answering question 2 as well in the chat. And once again, if you have questions for Chilekwa, maybe you want to know a little bit more about how Zambia has got to the point that they are at now, feel free to engage in the chat, and Chilekwa can respond where she can. So we have a question in the chat as well, which I feel Chilekwa or Cindy, either of you could respond to, just around if poison information centers can gather data on illegal pesticides that are causing poisonings, and what that would look like.
I can go first. I think they could gather that data, because if you have a database of all the pesticides or chemicals that are implicated in the poisoning cases that you're seeing, then you will be able to tell from those pesticides that you're seeing, or the poisoning cases that you're seeing, whether the pesticide is indeed registered or it's a legal one. So you are able to tell that this is not registered and this is an illegal pesticide. For instance, during the survey, we were able to find some of the pesticides that the environmental agency has banned, but you are able to find them in the communities, and they are also causing poisoning. So I think it can provide that information. Often, thank you.
And I can also just come in. We have collected in South Africa some data on so what we loosely term street pesticides. So we have an idea of the number of people who report, or the cases that get reported to our helpline. But we lack the laboratory, the ready kind of analytical laboratory support to be able to identify exactly what the active ingredients are in all of those. That would be amazing, because we can identify which patients are using unregistered pesticides, but we are not able to, as I say, to identify the actual active ingredient, which would be really helpful.
Great. Thank you so much to Cindy and Chilekwa. So I think we will wrap up this poll in a few minutes. So Chilekwa, if you have anything you would like to comment on in this poll, or yeah, anything you would like to say, then we can do that, and then we can move on to the next poll. Okay. Sorry, Chilekwa, I just want to check that you don't have anything to say for this poll. And if it's okay if we move on to the next poll.
Thank you, Maxine. I just wanted to mention that we have the legislation, like has been shared, I think, by many Zambians in the discussion. But I think what is really missing is also its regulation. And I saw someone post in the chat that diclofos is repackaged. So from our field survey, we were able to see how they repackage from the original container into small, maybe used juice or water bottles. If the client is not able to buy a full bottle from the retailer, and this increases the vulnerability and the exposure at household level. So that, I think, we need to strengthen either the legislation of the repackaging and also that policy recommendation, which was included in the survey, to maybe change the formulation or completely ban this pesticide from the market, because it's really grown into this huge public health issue in the country. Thank you, Maxine.
Great, thank you so much. So I think we'll move on to the next poll question. As you can see, we have a new poll. How can banning and or changing the formulation of pesticides reduce suicide cases or pesticide poisoning? So once again, please use the link that has been posted in the chat to post your responses, or go to menti.com and use the code at the top of the screen.
Maxine, as we're getting feedback on the poll, there was a question, I think, on how it's taken in, what are the exposure routes. And like I mentioned, most of this is intentional, so it's ingested, unless the accidental one, which may come through maybe contaminated water or food. But I think the biggest problem that we have is intentional, so it's taken directly and through ingestion. There was a question in the chat, so I thought I could give feedback on that. Thank you.
That's great. Thank you so much. We have one more poll to get to just before we close off our discussion. So if you would like to still respond to this poll, please do so now using the code on the screen when you go to menti.com or the link in the chat. And then we'll wrap up this poll and head on to the next one. Chilekwa, before we move on to the next poll, I just wanted to check if you have anything that you would like to discuss with regards to these responses to this poll.
Thank you, Maxine. Interesting feedback and contribution. I just want to state that we need to take action. Either we go with the banning and see how that helps the current situation. I'm not too sure of the change in formulation, because for this, as a country, we import our pesticides, so that might be a bit on a challenging side. I think it will require a lot of resources and analysis to ascertain that the formulation has actually been changed. But for banning, I think it's one of the ways I've seen, even research. I think it must be Sri Lanka did ban some highly hazardous pesticides, and from following the banning of those pesticides, the suicide cases reduced by over 70%, according to that a study in Sri Lanka. So I believe if that is done, of course, it should be followed with all the enforcement that it requires. I've seen comments where people are worried that when you restrict or ban a product, it leads to more illegal substances being on the market. And also the issue of looking at alternatives should also come in. I think there should be other pesticides that can be as effective as diclofos, for instance, but less toxic to humans as well as the environment. So that is something that we may need to explore further and see how that can be implemented. Thank you.
Great, thank you so much. So for our final poll today, we have: how can poison information centers increase awareness about pesticide poisonings among policymakers and the public? So once again, you can use the link posted in the chat or go to menti.com and use the code above at the top of the screen. We will wrap up soon, so please submit your responses as soon as possible and continue to engage in the chat. Yeah, I think we will wrap up soon. So please post your final responses to our poll and any final inputs into the chat. Chilekwa, I will ask you just to wrap up with some final thoughts, and then I will close off the discussion for us today.
Okay. Thank you, Maxine, and thank you, everyone. So, like I've mentioned, the need for having a poison center established in Zambia has been on for a very long time, and I'm happy to say we've made strides to put everything in place and have this center running, but we still need some TAs from especially well-established and functioning poison centers, so that we could learn how they actually started and the challenges they encountered and how we can overcome that. And for our policymakers, yes, I think there was a comment to maybe go through the parliamentarians so that you do get a buy-in from there. We can also do that through policy briefs, like has been mentioned here. So we need to share that. So what we've done, we've put up some policy briefs. Among them includes diclofos, and there's another one that is also implicated in suicide and poisoning. I think it's aluminum phosphate. So there are policy briefs that have been drafted, and these will be shared to policymakers so they can also see and appreciate the extent of the problem that we're dealing with, and possibly look at supporting our effort and ensure that the poison center is established and running for Zambia, so that we can also have a red dot on that beautiful African map. Thank you, Maxine, and thank you, everyone.
Great, thank you so much, Chilekwa. And yes, thank you to all of you who have attended our discussion today. Thank you for your inputs on the poll questions as well as in the chat. This seems like a great topic to be discussing at the moment. And let's hope that we can make some further inroads in Africa with poison information centers in the future. So to close off, Natasha, you can take us to the last slide. I would just like to thank all of both of our presenters, Cindy and Chilekwa, for their expertise today and giving us their time and presenting for us today. It's really been a privilege to have you, and I have thoroughly enjoyed it, and I hope everyone else has too. Just a thank you to Natasha as well for all the background work and all the effort that goes into coordinating these discussions. We really appreciate it, and we hope that all of you enjoy these discussions as much as we do. If you have not registered for the PDF or for our pesticide network, please consider doing so. There have been links posted in the chat, so please feel free to click those links to register and become a member of our network. After this discussion, we will be distributing a digest as well as the PowerPoint slides to everyone who has attended today, so that you may be able to see what was discussed and have some useful resources with you as well. Our next discussion will be on the 19th of October, and the topic will be on gender and pesticides. The registration link has been posted in the chat, so please feel free to register now and get that in your calendar. It is going to be a great discussion. Thank you once again for joining today, and we will see you next time at our next discussion. Have a wonderful day further.